we're hoping that with conversations, they will come out and they'll see the need to come out and get tested. Today we are focusing on the community of FRAZER'S content. We are doing that because we've had a number of cases and we want to ensure that persons are fully advised as to what to do. The whole matter of distancing, the whole matter of hand washing, hand sanitizing, very important. And one of the challenges they're having here is that persons are not wearing masks and they are gathering in large groups. And so what we're trying to do today is to sensitize the community as to what is expected, what they're supposed to be doing. So we have the team here, the public health inspectors, the community health aid doctors are here to do screening, and then the community health aides will be going out in the community with the inspectors to do line listing, sensitization, speak to the persons if they're having symptoms. We'll be documenting it, taking them to this area here where the testing bus will be. We'll be testing this morning for COVID. Persons who are willing to come out, volunteers, those with symptoms, we'd advise them to come out and get tested. So that's our mission today, to really sensitize the community about COVID, what is expected of them, and with doing all of that, we're hoping to break the transmission. The little area that we had sampled, we got about 5 cases, and so we're channeling these particular areas to ensure that persons know what to do and ensure that they are being isolated, they're taking their distances and so on. And so this is why we're heading out today, to ensure that we saturate this area, give them pamphlets, hand out masks, and so that we can break the transmission. So that's the plan today, and that's why we are here today. A number of them not willing to come and test. They say nothing is wrong with them. They don't see why they need to test. They say it's uncomfortable. And so, these are some of the things we're getting from them. But we encourage them and tell them it's not as bad. It's a little uncomfortable, but it's not as bad. And it's very important to know your status. And so we try to encourage them to come out and get tested. They are afraid, yes, because once persons know that they had it, like they scorn them, they try to stay away from them, and some persons don't want to come and get tested. And if they get tested, they don't even want other person to know their status. So that's a challenge we're having. But we tell them it's not as bad once they maintain the distance, once they sanitize, once they stay indoors, stay away, because remember, we transmit it, and if you stay away and keep your distance, then the whole matter of transmission will be broken.
Listen the news on the radio, how much person dying by a day, how much 500 and so we'd like to take the test.
Would you recommend other persons taking the test?
Yes, it's good to know if you have the COVID that you can take a cure or the test to be quarantined or so.
What prompted you to come out here today to do your COVID test?
To know my status.
Have you ever done any tests before?
Yes.
And how was the experience?
First one was bad, this second one was okay, this one was okay.
Would you recommend other persons to come and do the same?
Of course, yes.
And so far, do you think persons are taking this COVID serious?
Some, but not everyone. I am.